Hello everyone, and thank you so much for joining me today as we talk about a more natural approach to oral health. I'm Lancette Van Gilder, dental hygienist, coming to you from Reno, Nevada. Before we start, I'd like to thank Premier Dental for sponsoring today's continuing education course. I also want you to feel free to ask me questions as we go along. I'll be saving about 5 minutes at the end of the presentation to answer questions. But if I don't get to your questions, please feel free to jot down my email here, lancettevg@gmail.com, and I would be happy to provide any references or resources or answer your questions if I don't get to them in today's presentation. I am absolutely here to help. And I'm very excited to be doing this course today. On today's agenda, we're going to be talking about the prevalence of alternative medicine use, talk about some reasons why people are preferring a more natural approach, the role that patient-centered care now plays in our conversations with our patients. We'll take a look at the environment and the role that's playing in our patients' purchasing decisions. We're going to touch on a few natural practices such as brushing with dirt, oil pulling, chocolate for oral health, essential oils, and teething jewelry. We'll do an introduction to acupuncture and dentistry and finish it up with do-it-yourself trends. I decided to build this course a few years ago when patients were coming in asking me really interesting questions, things that I hadn't really heard before. About 5 years ago, somebody came in and asked me if they could swish with coconut oil for 20 minutes and asked if it would improve their oral health. That was the first time I had ever heard of it. Now, of course, we've heard of some of these things a little bit more frequently, but 5 years ago, I had no idea what to say. In the coming days and months after that, it seems like I was getting questions all of the time from patients. People were asking me if I had a really great recipe on how to make your own toothpaste, if they could brush with dirt, if oral health products fit into a paleo lifestyle, or which products that I could recommend were gluten-free. So that's what prompted this course. It's been building over the last couple of years. It now has turned into pretty much a full day CE course. Today we only have 1 hour, so we're just going to touch on a few highlights. So you're not going to find out everything that you need to know about natural practices today, but the intent is for you to feel empowered to help guide your patients in product recommendations and to help you feel more comfortable as you navigate conversations around a more natural approach to oral health. There are probably 2 big takeaways from today's course that you can actually start working on immediately tomorrow or next week when you go back to work. The first one is cultural sensitivity. Being a lifelong learner is crucial for today's dental professional. And we know if we spend time raising our cultural awareness, we can build our cultural knowledge, we'll have more empathy, we're more likely to build trust and respect with our patients. This in turn can enhance our diagnostic and assessment skills, which we know will ultimately improve our clinical skills and allow us to deliver patient-centered care, which is now considered the standard of care from our professional associations. So let's talk about brushing with dirt. It actually is bentonite clay. It's mined from the earth. It has a slight electromagnetic charge that's activated by water with an alkaline base. There's no research to support that it can actually remineralize teeth, but it is a tooth powder that's intended to be a mild abrasive and help neutralize the pH of the mouth. There are a few tooth powders that have been proven to be safe for tooth structure and not abrasive, and these are the ones that you would want to guide your patients to. Products that have actually done research to be safe for teeth. However, I will say that not all of them have, and if they do, a lot of them don't advertise. So you have to be the good advocate for your patients and either do some research on your own or encourage them to check product websites or to even email the companies directly. But if you have a patient that wants to use a tooth powder, I would highly recommend that they use one that has committed to safety standards and clearly advertise them. These are a couple products, for instance, that I know have been proven to be fairly safe for tooth structure. The dirt, you can get it at givemethedirt.com, uses extra fine bentonite clay, baking soda to neutralize the pH of the mouth, cinnamon, myrrh, nutmeg, essential oils for antibacterial properties and taste. They advertise it to be paleo paleo-friendly, no fluoride, no dyes, no xylitol, and no glycerin. My favorite tooth powder is Earth Powder by Redmond. If you see down here on the right side of the screen, they do advertise the abrasiveness level is between 39 and 109, depending on which product that you're looking at. So they have definitely done testing to prove that this is safe. It's not super abrasive. This one you can get at brushwithmud.com. Black licorice, xylitol, sea salt for antibacterial, fennel essential oil, activated charcoal for some supposed whitening properties, and they advertise it to be vegan. There's also products for children down here on the lower left. My mini Dirty Mouth, no artificial dyes, flavorings, or coloring. The sweet bubblegum flavor actually comes from the monk fruit. And then we have kind of a new emergence of products coming that kind of fit more Eastern medicine but are manufactured and made in the United States. So this one down here on the lower right is actually made in the USA with bentonite clay from Wyoming. So how about brushing your teeth with chocolate? I'm going to play a quick video here.
Want to hear something that will make you smile? What if we told you chocolate could build healthier teeth? Theodent harnesses the power of Renew, a non-toxic and patented substance found in the cacao plant, the source of chocolate. And unlike fluoride-based toothpaste, it's not harmful if swallowed, is 100% kid-friendly, and it tastes great. Out with the old, in with Renew. Theodent may be purchased at Whole Foods markets nationwide.
So I don't know if any of you think that brushing with chocolate is a brilliant idea, because I think we all love chocolate. There's actually a little bit of science behind this. The ingredient is actually theobromine. A study came out from the University of Texas in 2013 showing the ability of theobromine to remineralize tooth structure. Although this is only kind of one limited study, a lot of people who are really against fluoride seem to be very, very attracted to theobromine. This product in the middle, the Theodent Kids, is a chocolate-flavored toothpaste, but the one on the right, the Theodent 300 that comes in the white container, that is the one that contains the therapeutic levels of theobromine. And I want you to notice the price tag here, $119 for one tube of toothpaste. This Theodent 300 was made very popular because of celebrities, like Gwyneth Paltrow uses it. She started a lifestyle and wellness company a couple years ago called The Goop, and she talked a lot about oral health products in her new business, and this is the toothpaste that she uses. So it made them very popular. It actually uses a theobromine. One product that I've actually encountered a lot of patients using is this one on the left-hand side that you can get on Amazon. Not only does it have the theobromine, but it also has coconut oil, and it's a moisturizing spray. The patients that I have seen use this product love this product because it gives them moisture. Most of them are using it for dry mouth. They know that because they have a dry mouth that they're at higher risk for many other problems. And most people who are using this are people who just absolutely don't want to use fluoride, but know that they're at high risk. So they're hoping that maybe there is some promise behind the theobromine. This picture on the left, I want to show you what some of the marketing and advertising behind this looks like. The Theodent dress, fluoride is never in fashion. The picture on the right side is a great hygienist I met a couple weeks ago in New Jersey when I was giving this course for a few hours. She had attended a dental conference a few weeks before I met her, and she came to my course, and she won this as a raffle prize at the event. She still hadn't opened it. She had no idea what the Theodent product was, and she was dying when I told her that that white box there was a $120 tube of toothpaste. So I'm anxious to see if she's been using it or not. So can we prove some of these things? You know, what does the research look like? That's probably the hardest thing about doing this course, is there just really is not a lot of research behind a natural approach to oral health. So as we go through today, I will be pointing out some research studies, but I want you to know that there's very, very little research behind a lot of these things. But let's just revisit this research pyramid real quick. If you look down at the bottom, we know that all research kind of starts in a lab, most likely, sometimes animal testing. And then as we go up to the top of the research pyramid, when we get up here towards the top, more of these randomized controlled trials, these meta-analysis, these systematic reviews, clinical practice guidelines, we know that that's much, much more credible compatible research. There's a lot more research. It's better quality research. So as we go along in today's presentation, we have everything from theobromine, which is way down here at the bottom, all the way up to the top, more meta-analysis studies, and I'll kind of point those out as we go through. But know that everything kind of starts down here at the bottom, and we hope to build up from there. The other big takeaway today, in addition to, cultural sensitivity, the other big takeaway that you can start to implement right away if you haven't is the importance of conducting thorough risk assessments. A proper risk assessment should take place before any diagnosis or any treatment planning, as well as any product recommendations. No longer is it considered the standard of care to have the same dialogue prepared for each patient. With patient-centered care, a risk assessment is performed and dialogue is based on the findings. So treatment plans and product recommendations may vary greatly throughout the day based on your risk assessments and the conversations that you're having with each patient. As a general rule, a more natural approach to oral health may be the most beneficial and appropriate for prevention or for our low-risk patients. It can also serve as a motivator for our high-risk patients as a goal to obtain once they have established health. There are many ways that you can complete a risk assessment. You can create your own template. You can ask a consultant to help you. You can go to the ADA website, or there's a really great electronic version on phillipscare.com. As we move forward, I also think it's really important to point out the proper name for a more natural approach to health in the United States. Right now, the new term is complementary and integrated health. It used to be complementary and alternative medicine, homeopathy. There's actually been a few names over the last 20 years. The National Institute of Health has a department that funds research for alternative medicine in our country. In 2016, they were given a new name and a new mission statement. This department has only actually been around in the United States for about the last 19 years. And during the first 15 years, there really was no research coming out that was really improving the health and well-being of citizens in the United States. And the department was very close to being eliminated. However, after a lot of surveys and research, we found that more and more people are seeking out a more natural approach to health in general. Our military is using alternative medicine, hospitals and schools, and all kinds of places are turning to this now. And so instead of eliminating the department, it was given a new name and a new mission statement. And the new mission statement states that it's to enhance overall health, to prevent disease, and to alleviate debilitating symptoms such as stress, pain, and anxiety management. They have about $130 million budget, and hopefully now we'll start to see some really good research coming out. In the past, some of the research that was being done were studying things like shark cartilage to treat prostate cancer, distant prayer to help treat AIDS, and things like that. So new mission, new name, and hopefully maybe we can see some good research coming out of it. I want to point out the new name so you know what the proper term is called, but I also want you to look at this mission statement. Nowhere in this mission statement does it say the mission is to either treat or cure diseases. In the United States, really, complementary and integrated health is all about prevention and wellness and helping people feel better. So how long has alternative medicine been around? Well, basically since the beginning of time, dating back to 6,000 years ago. So let's take a look at why now is it becoming so popular? Well, of course, we have media, marketing, and celebrities. Gwyneth Paltrow is saying a toothpaste is good. People want to be like Gwyneth Paltrow, so they're going to want to use it. We have really, really creative marketing. You probably noticed the packaging and the names of the bentonite clay, right? Brush with mud, brush your teeth with dirt, really cute packaging, hip, fun names, fun websites. We also have a national movement towards natural health because of things like antibiotic resistance, the opioid epidemic. We no longer spend all our time in little bubbles. Not only do we have global travel, international travel, we have the lovely internet. And it's quite interesting to see the role that the environment and politics is playing in healthcare as well. Of course, culture, geographic location, where you grew up, who you are around, cost and ease of use, trendy diet, lifestyle choices, health issues, wellness versus treatment, and a more focus on personalized medicine, that we don't all want the same, treatment. We want what's really best for us. One other reason why alternative medicine kind of made an explosion in the 90s was this landmark study that came out in 1996 about St. John's wort. This study not only showed that St. John's wort was as effective as conventional antidepressants, but it could be obtained at about a third of the cost and proven to have significantly less side effects. So St. John's wort is this beautiful flowering plant here, and the whole entire plant is used. The stems, the leaves, the petals, the flower. It can be put in teas. It could be put in capsule form and also in oils. 2016 meta-analysis, remember that's more at the top of the research pyramid. 36 studies proved the same results. So of course, once the media got a hold of this and pumped it out to the public, people started looking at herbal supplements as a natural kind of medicine. We do want to caution our patients using herbal remedies as medicine, though, because herbal supplements are not regulated by the FDA. There's no safety or effectiveness standards. There's problems with contamination and actual ingredients. And we have very, very limited research on specific conditions, for instance, St. John's wort with depression, but minimal to no research on the broad spectrum of conditions, other things that it claims to do, like help with weight loss and attention deficit disorder and things like that. We also know with herbal supplements that there is documented known drug interactions, specifically with heart and blood pressure medication, cholesterol medication, erectile dysfunction, gastric reflux, migraine, seizure medication, cough medicine, allergy medicine, and antidepressants. So how many people right now are taking prescription drugs in our country? Well, just about everybody that walks in the door. According to the Mayo Clinic, 70% of Americans are taking one prescription drug, and 50% are probably taking 2 or more. So how many people in today's society are using complementary and integrative alternative healthcare services? Well, according to the Journal of the American Medical Association, there's extensive use in the United States. Well over 50% of people are using it now. We know that U.S. insurers and managed care organizations now offer alternative medicine programs and benefits. The majority of U.S. medical schools now offer courses in alternative medicine, and it's being used in all branches of the military and most United States hospitals. Who's using it? Well, between the ages of 30 and 50, you're more likely to use alternative medicine. If you make a little bit more money, you're more likely. If you make $50,000 a year or more. If you have a little bit of college versus no college, you're more likely to use alternative medicine. And of course, geographical location plays a big role. For instance, higher use is significantly higher on the West Coast versus like the South. And women are about 10% more likely to use alternative medicine. So how about you guys? Do you think that you're using alternative medicine? I'm sure that probably at least half of you are. How many of you have seen a chiropractor? Probably a lot. Our profession is bodies. How about meditation, yoga, Tai Chi? How about therapeutic massage? If you're not getting massages, you should be, because again, our profession is extremely demanding on our bodies. If you're using essential oils, if you're drinking herbal tea hoping to get some health benefits, these are all considered complementary, alternative, integrative health approaches. According to the National Institute of Health, there's 3 different types of complementary integrative health approaches. We have natural products, herbs, spices, vitamins, minerals, probiotics, and dietary supplements is the most common practice in the United States. Mind and body practices, yoga, chiropractic, meditation, massage, acupuncture, Tai Chi, hypnotherapy, and we have others such as healers and prayer. Top reasons cited for increased use of alternative medicine in the United States: back and neck problems, allergies, arthritis, and digestive issues. You can probably see a little bit of a trend here. These are typically things that are really difficult to treat with traditional medicine. You know, maybe medication didn't work, maybe therapy didn't work, maybe surgery didn't work, so people are seeking out something, some way to feel better. The majority of alternative medicine use is without any input from a medical doctor or an alternative medicine practitioner. But there's a little silver lining here. This 50 8% in the purple star, 58% of people are turning towards alternative medicine for prevention, for wellness, to just feel better. So one of the first questions I ask my patients when they're coming in and asking me about a more natural approach is, wow, that's a great question. Why are you interested? And if we know that it's more for prevention and wellness, that's a totally different conversation than actually curing or treating diseases. And we are very prevention oriented in dentistry, so that helps give us like a leg up right there. So is it effective, complementary, and alternative medicine? Well, according to patient testimonials, for just as it saved their lives, there's just people that said it wasn't helpful. What we know is we need more scientific trials. The research is either non-existent, it's minimal, and not a lot of it is credible. There's small groups of subjects. They're not blinded or well controlled. However, early trials are proving some efficacy. We're only going to touch on briefly on a couple different types of alternative medicine. There's a whole bunch of different kinds: Rheumatology, Ayurveda, Kavala, Gandusa, and more. Believers in Rheumatology believe that there's a direct relationship between everything in our lives, between people, plants, animals, and elements of nature and our health, and that our health. They believe that herbs can be medicine. Foods not only provide us with nutrients and enzymes, but high-dose vitamin therapy can prevent disease and cure disease, which is why we've seen a 380% increase of high-dose vitamin use in the United States. ID therapy believes that every single thing in our body is connected by an energy kind of nerve pathway. This is where nerve mapping and meridian charts come into play. And then color therapy. Eastern medicine and Western medicine both agree that light spectrum frequencies govern our hormones. But believers in alternative medicine also believe that color therapy can actually cure and treat diseases. That's where we have colored gemstones, colored crystals, colored water, wands, fabrics, and beads. There's no research to prove that this is actually therapeutic. However, most people do feel better with these things like these Himalayan salt lamps. There's no research to prove that there's actually health benefits from them. And there is specific colors for specific body parts, diseases, and energy patterns. We've seen a big explosion across the United States with these salt caves. Actually here where I live in Reno, Nevada, we have a casino that has a really lovely spa. They actually have a salt room in the spa. Believers believe that if you go and sit in here and inhale this salt, that it will have magical kind of healing properties. There's about 150 different trials out there on the benefits of, researching this halotherapy, and 149 of them show that there was no healing benefits whatsoever. And professional associations, experts in respiratory diseases and allergies and asthma warn against the use because there's no therapeutic benefit, and this actually might be considered an irritant. You don't know until you go in how you're going to react. So they don't recommend them at all. Rheumatology also believes that stress plays a key role in our health and that we cannot deprive ourselves too long of poor nutrition, stress, no exercising, poor diet without having to pay for it, and that a lot of disease is just caused purely from stress. Ayurveda is the primary healthcare system of India. It's interesting that they consider Western medicine, what we practice, to be alternative medicine. I want to point out that there's not a lot of research, minimal research behind Ayurveda because they believe they don't need it. Practitioners of this have been, practicing this their whole life, and it goes back generation after generation after generation. And they teach each other and learn through stories and practices that have worked for other family members, and that's all the research that they need. Ayurveda practice is all based on balance and energy flow throughout your body. There's a whole bunch of different components to it that include about 114 different hymns and incantations. There's herbal supplements, mineral or metal supplements, surgical techniques, the use of opium, oils, and massage. Ayurveda is regulated only as a dietary supplement in the United States and not required to meet the same safety and effectiveness standards as conventional medicine. In fact, some interesting studies have been done with Ayurvedic products specifically in the United States, manufactured in the United States or India. 21% of them were found to have toxic levels of lead, arsenic, and mercury. And you probably find this interesting because these are the number one things that people who want a more natural approach to health, they don't want any of these things, yet 20% of products contain toxic levels of these ingredients. Herbal supplements in general, this is just staggering to me. If you were to buy a whole bunch of bottles of St. John's wort, for instance, 79% of them probably don't even contain any St. John's wort at all. A vast majority of herbal supplements don't even contain the primary ingredient that's listed on the bottle. And research is showing that these bottles are containing byproducts like rice, wheat, houseplant DNA, pine, and alfalfa. The FDA made this statement in 2016 that dietary supplements can be beneficial to your health, but they could also involve health risks. And the FDA does not have the authority to review dietary supplement products for safety and effectiveness before they're marketed. So this is where oil pulling comes from. It's a thousands and thousands year old practice of Ayurveda. It's making a comeback in today's world because we're overloaded with toxins, stress, pollution, antibiotics, GMO, animal byproducts. But they also acknowledge the fact that many problems either start from the mouth or are related to the mouth. Proponents of oil pulling claim that it can cure tooth decay, it can kill bad breath, heals bleeding gums, prevents heart disease, reduces inflammation, boosts the immune system, soothes dry throat, whitens teeth, and heals cracked lips, improves acne, strengthens gums, and prevents cavities. Wouldn't it be wonderful if we had such a miracle drug? I think we would all embrace that. But here's a little bit of the theory and science behind oil pulling. The theory is our body stores these toxins in fat cells as a defense mechanism. Toxins can be bacterial, viral, fungal, pollution. Oil pulling provides a solution to pull the toxins out so they don't keep building up. The science behind it is most oils are antimicrobial, antiviral, and antifungal because they contain lauric acid. Lauric acid, specifically that found in coconut oil, seems to be able to inhibit the growth of strep bacteria. How do you do oil pulling? You take a tablespoon of unrefined cooking oil, such as sesame, coconut, or sunflower. Coconut is the preferred. Place it in your mouth and gently swish. Depending on which type of alternative medicine practice you are actually practicing, you will swish for different amounts of time. So Ayurveda is where the 20 minutes come from. You can start small, work your way up. Kavala, you can fill your mouth with liquid and hold it there for a few minutes, up to 4 minutes, a couple times a day. Again, do so you can hold it there for 3 to 5 minutes, spit out, and repeat. Not only is it about pulling out toxins, but remember, the primary reason for Ayurvedic or alternative practice is to balance our energies, which is called our dashas. We have 3 different types of energies, and while you are swishing with this oil, it is intended to also help balance your 3 types of energies: your creative, energetic side, your intellectual, powerful side, and your thoughtful, loyal, supportive side. What do we have for research for oil pulling? 2009 study, small study, 20 adolescent boys with plaque-induced gingivitis. And it did have the ability to reduce strep mutans, which we know is a major cause of decay. However, no follow-up was done to determine if caries was actually reduced. 2013 study, larger study, similar results, reduced strep mutans and demonstrated short-term effect on plaque and gingivitis, no long-term study. 2017, short-term study again with 40 college students. It was effective at reducing plaque by the 7th day. 2009 research, oil pulling versus chlorhexidine, randomized, controlled, triple-blind study. Remember, that's a little higher on the pyramid, comparing oil pulling to chlorhexidine in the management of gingivitis. The results were that swishing with coconut oil was as effective, with less stain and aftertaste, no documented allergies, 5 to 6 times more cost-effective, and the outcome was more of a potential preventive modality. 2016, this was actually published on the Premier Dental Facebook post a couple weeks ago. International Society of Community Dentistry, girls 8 to 12, swishing for 2 to 3 minutes a day, same results as chlorhexidine in the reduction of strep mutans. Of course, there are side effects with all natural products is possible, especially for long-term use. Can you imagine swishing for 20 minutes? Dry mouth, excessive thirst, muscular stiffness, exhaustion, loss of sensation or almost a numbing in the mouth. That's typically for people who are doing it for that 20 minutes. Could lead to upset stomach, diarrhea, mineral oil aspiration, and lipid pneumonia. So what do we know about oil pulling? Very limited research, very small sample sizes, no long-term or follow-up studies. We know that biofilm is very difficult to disrupt. It matures and becomes very difficult to disrupt. So again, intervening in the early stages, probably much more successful, and cause and effect is very difficult to substantiate. What does the American Dental Association say about oil pulling and oral health? Due to lack of available evidence, it's not recommended as a supplementary oral hygiene practice, and certainly not as a replacement to standard, time-tested oral health behaviors and modalities. Other Ayurvedic remedies, just kind of some funny things. If you want to eliminate chin hair, you can consume 2 teaspoons of blackstrap molasses daily to balance hormones and stop hair growth. Or if you want to speed up hair growth, you can ingest curry leaves and speed up hair growth, improve digestion, and control your cholesterol. There are products that just specifically specialize in Ayurvedic practice. Ayumira is one. Again, you can get it on Amazon. They make toothpaste with 26 different botanical extracts, essential oils, mouthwashes, alcohol, sulfate-free, and toothpicks that are dipped in neem bark. So what's in your tube? Which toothpaste, which products do you actually want your patients to use at home? We have a very small window to assess oral health and make recommendations, a couple visits a year for lucky. However, our patients are using products daily, maybe even a couple times a day. They're seeking advice from the internet, from friends and family, and who knows who else. Companies have been doing targeted marketing to eliminate the dental professional completely from oral health products. Beauty and wellness companies are developing their own line of oral health products. So it's imperative that when we have the chance, when we actually have that patient in our chair, that we educate them about their risk and their needs and the need for individualized recommendations. What may work for one person may not work for them. I know there's a lot of information on this slide. It's just really important to just look at the statistics right now because I think that this is really sobering. We have a massive oral health problem in our country. How many patients a week are coming in with any of the following? With caries, tooth decay. 30% of children have untreated tooth decay. 30 to 50% of working adults have untreated tooth decay. And the Pew Trust says that by the time somebody reaches over the age of 65, 96% of them will have a caries experience. And the stats are even worse for gum disease. But 90% of the population will experience gum disease at some point. 50% of people over the age of 30 have periodontitis, which means permanent bone loss. At least 30% of the population has sensitivity, probably more because they don't want to tell us. White spot lesions, demineralization due to acid challenge. If 70% of adults are taking prescription medication, we know that dry mouth is one of the #1 side effects of medication. We have acid reflux, and again, this abrasion and erosion due to the acid challenge because of our habits and lifestyle. For instance, look at the pH of sparkling water. It's one of the worst things that we could drink for our teeth. pH of 3, coffee is a pH of 5, beer and wine a pH of 4. These are things that most of us love. Juice, soda, flavored teas, pH of 3 to 4. We know that enamel and dent damage can occur very rapidly when our pH drops below 6. So almost all of us are getting an acid challenge on our teeth every day. Probably one of the most important things that we can talk to our patients about is not using abrasive products. A good portion of products out in the market are considered medium to high abrasive. We know that anything under 200 is safe. However, we want our patients to probably be using something at the very, very bottom of this abrasive chart. If we know that most people are going to experience tooth decay, sensitivity, demineralization, acid reflux, acid challenge from our diet, periodontal disease, we want our patients to be using high quality products that are as least abrasive as possible. I'm sure most of you probably remember this. This is the typical board question. Stannous fluoride still is the only fluoride that is anti-caries, anti-gingivitis, and works for hypersensitivity. That's why we're seeing a big explosion of products coming back on the market. Stannous fluoride is in right now. It is an exciting time that we are seeing great innovation in at-home products for our patients, especially for those seeking a more natural approach. We've known for decades that fluoride is critical for remineralization. But what we've learned about fluoride is that it does not always matter how much fluoride a product has. What's important is how much fluoride is actually available to the tooth surface. The addition of amorphous calcium phosphate, or ACP technology, has been a game changer in fluoride availability. When this is added with fluoride, we know that more fluoride uptake is possible. In Enamelon here, for instance, not only are there multiple benefits from stannous fluoride, there's the addition of ACP technology, which leads to significantly better remineralization of the tooth structure with 1/5 the amount of fluoride. So fluoride technology is now working smarter. More benefits with less fluoride is a great thing that we can offer our patients. What else is different? We have the stannous fluoride, the ACP technology. We also have ultramulsion. Copolymers have been added to this product that creates a very slick surface on the tooth surface for hours after use. So bacteria cannot attach as easily, and this also may help prevent with staining. The addition of the herb Spilanthes helps promote moisture, and we know that this product is great for all ages. What I forgot to mention on that slide before is not only do 30% of children have untreated tooth decay, but a good portion of children are getting their first caries experience before the age of 3, and we know that 5,000 parts per million fluoride is not indicated for children under the age of 6. Spilanthes is a flowering herb extract that naturally stimulates saliva. Really, really great for dry mouth. Also gives it its nice kind of soothing mint flavor without any additional flavorings or dyes or color. Additional benefits of a product like this: no sodium lauryl sulfate, no gluten, no milk proteins, no dyes, and look at this awesome RDA value of 8. That's at that very, very bottom of that list. So our product recommendations should really be based on risk assessment. Baltic amber teething beads. These are amber beads that specifically come from the Baltic Sea. They make up bracelets and necklaces known as teething jewelry. The intent is that the baby wears the jewelry, and the beads promote healing, pain relief, and assist with drooling. The science behind the beads is that the Baltic amber beads contain succinic acid. The theory is that the body temperature heats the beads, releases succinic acid on the skin, and absorbs into the body. High doses of succinic acid have been proven to provide pain relief in mice, and low doses of succinic acid are naturally occurring in our body. To date, there is no evidence to support Baltic amber teething beads are safe or effective. Proponents of these teething beads actually claim that they can not only provide pain relief, but they improve the body's immunity and blood circulation, fight off infections, irritations, and respiratory diseases, help with muscle pains, transmute negative energy into positive, relieve depression, and help liver, spleen, and adrenal disorders. However, there are significant concerns with teething jewelry. Canada has banned the sale of them in 2010 due to risk of strangulation and choking, and advised that the jewelry of any kind not be used under the age of 3. And in Ireland, they were banned in 2015, citing strangulation concerns. What we know about Baltic amber teething beads: no scientific evidence that succinic acid offers pain relief in humans. There's no evidence that succinic acid can be released from the beads. In fact, they probably would have to be heated to about 187 degrees to release succinic acid. And if it was released, succinic acid is classified as a skin irritant by the FDA. But the most significant thing is serious choking and strangulation hazards. For testimonials, for just as many people say that it saved their life, there's just as many that say it didn't work. Essential oils, very, very heavily studied and very, very popular today. Essential oils are liquids that are distilled from plants. The whole entire plant can be used, seeds, stems, roots, flowers, fruit, and bark. The therapeutic value comes from its components. It depends on where the plant grew, the soil, the chemicals, what part of the plant, the climate, the harvest method, and the distillation process. Only pure therapeutic grade oils should be used for holistic health care because they are considered safer, less toxic, and more researched. It is difficult to find pure oils, and if you do find them, they're expensive. Companies like doTERRA and Young Living provide very, very high quality oils, but they are going to cost you more. It takes several 100,000 pounds of plant material extract to produce 1 pound of pure oil. So more inexpensive oils may smell better, but process faster, less quality, and may not have any therapeutic benefit. So why are essential oils so beneficial? Because they have a very, very small molecular size, lipid soluble, and quickly penetrate the skin. Essential oils can be placed on the skin and reach every organ in the body within 20 minutes and completely eliminated from your body within hours. Essential oils, because of the small molecular size, can also penetrate cell membranes, even hardened, diseased cell membranes. It also crosses the blood-brain barrier, which very few molecules can do, and it does cross the placenta. Essential oils have been proven to be very powerful antioxidants, and they help diminish oxidative stress and free radical production. What this means is it keeps your cells healthy and helps fight off disease. Essential oils have also been shown to be antiviral, antifungal, antimicrobial, antibacterial, anti-tumor, antiseptic, and antiparasitic. And they've been around since the beginning of time as well. 35 jars were found in King Tut's tomb, many references in the Bible and the Torah, specifically with frankincense, rosemary, and myrrh. There's 3 different ways you can use essential oils. You can diffuse it into the air, you can smell it, or you can place it topically on your skin, or you can ingest it. Again, only 100% pure therapeutic oil should be used for any of these methods, and if you are going to ingest it, you need to make sure that it's labeled to be used for ingestion as a food additive or as a flavor. We do have documented drug interactions with essential oils, so they're not for everybody. Documented possible drug interactions with anticoagulants, aspirin, SSRIs, anti-diabetic drugs, dermal medications, antidepressants, and more. So again, if we think about how many patients are on these medications, maybe they're not a good candidate for essential oils or should definitely be talking to their physician or pharmacist about it. Essential oils and oral health meta-analysis, remember that's way up at the top of the research pyramid, 2015 Journal of the American Dental Association, stated enhanced benefits of essential oils with mechanical plaque removal with a variety of different flavors and have been proven to be anti-gingivitis and anti-plaque. Specifically, lavender, myrrh, melaleuca, tea tree oil, cinnamon, eucalyptus, rosemary are all available to have an impact on gram-negative and gram-positive bacteria. It can also be used for bruxism, inhalation. You can smell it, diffuse it next to the bed, or topically apply it under the nose or the bottom of the feet or the back of the neck. And calming blends have been shown to be successful. Things with lavender, chamomile, sandalwood, vanilla bean may help aid our nervous system, calming nerves and emotions. Essential oils are also being used for tobacco cessation, helping reduce cravings, inhalation, smelling black pepper oil, or topically placing clove or black pepper oil on the tongue. You should absolutely not vape essential oils. Essential oils have not been researched to be vaped or inhaled in this manner with the heat. There's no long-term research to prove that it's safe. We get very concerned about releasing chemicals causing inflammation and damage to the cells. Of course, you can get this on Amazon as well. You can find essential oil kind of little pods that you can vape. We absolutely don't want to recommend vaping essential oils. Companies like doTERRA are actually making targeted products for dental offices, such as this On Guard whitening toothpaste and these little peppermint beadlets. And how about staying relevant? Let's talk about the environment. This is probably my favorite part of this whole conversation because it's very, very relevant today. Will we be banning plastic toothbrushes? I live in an area where it's almost impossible to get a plastic bag or a plastic straw. These have been banned. So will plastic toothbrushes be next? Look at this ad. Peace out, plastic. California knows what's up. Plastic bags are done. Let's see what else we can do. The Woo Bamboo biodegradable toothbrush. This was really interesting. This was just last week, about a week ago. The European Parliament banned single-use plastics and a reduction on others by 2020, including cotton swabs, plastic forks and knives. A vote of 571 to 53. That's overwhelming support, saying that it's essential to protect marine life and the environment. And why? Well, every single toothbrush that you have ever used or that you have ever given out is sitting in a landfill or at the bottom of the ocean. In fact, about 50 million pounds of toothbrushes enter U.S. landfills every single year. According to a recent report, there will be more plastic waste than fish in the ocean by 2050. We have such a problem that in September we started the world's largest ocean cleanup because of the Great Pacific Garbage Patch. If you want to know more about this, I encourage you to go to YouTube and just Google the Great Pacific Garbage Patch, and they'll show you videos of how we're actually developing systems to clean up all of the garbage in the ocean. You know, about 70% of garbage in the ocean collects in this area and sinks to the bottom of the ocean floor. So companies are stepping up to the plate and problem solving and looking for ways to, protect our environment. Here is where we have bamboo toothbrushes. While the bristles are not biodegradable, the handle is. Bamboo toothbrushes can completely disintegrate and biodegradable within about 3 months after use. One of my favorite companies is Woo Bamboo. If you want a free sample, you can go to smiles@woobamboo.com and they'll send you free samples. They have wonderful products, really high quality bristles. They're intended to use until you're done with it, then snap off the head where the high quality bristles are. That part's not biodegradable, so the footprint on the environment is much smaller. They have adult toothbrushes, kids toothbrushes. I love these pet toothbrushes. They actually have biodegradable floss. So all those toothbrushes that you've used and given out are sitting in the bottom of the ocean floor, so is all of the floss. They make a biodegradable silk floss and mouthwashes and toothpaste. They also do customized toothbrushes, so you can have your office name or phone number or whatever imprinted into the handle. It's very, very cost effective. I think it's $45 to set up an account, and a toothbrush is about $1.17. So if you want to stand out from the crowd, if you want to be one of those offices that's looking to protect the environment, to appeal to all generations and protect the environment, you can look into these bamboo toothbrushes. There's other environmentally friendly toothbrush options also. Preserve, some offices give out these that are made out of recycled yogurt cups. After you use 3 different toothbrushes, you can put them into a water bottle, send them back to the company, and they will recycle them. And then there's completely 100% recyclable toothbrushes as well. Not only are all those toothbrushes and all that floss sitting in a landfill or in the bottom of the ocean floor, but how about all the toothpaste tubes? They are plastic as well. So new options are coming out, such as these toothpaste tablets coming in glass jars that are recyclable. The refillable packs are sent to you right to your home. You don't even need to go out and shop. You can sign up for automatic shipment. They advertise to be the perfect amount, eco-friendly, vegan, and TSA friendly. That's the other thing that people are looking for. It's getting increasingly more difficult to travel with liquids and paste. So this solves that problem. If you have patients that are looking for coconut oil products, these are some really great ones. The Hello toothpaste are awesome. They taste really good. You can get them just about everywhere. They have fluoride in them. I always tell them to get the pink ones. This rose color gold one here tastes great. It's made out of coconut oil and it has fluoride. And you don't even have to tell your patients that part. Just tell them to get the pink ones. The rose gold colored one, the hot pink, and the blue one here with the hearts, they all have fluoride in them. And then, of course, if you haven't tried Coco Floss, floss that has coconut oil in it, it is probably the most awesome floss you'll ever find. You can go to cocofloss.com. You can also order it on Amazon, but you can fill out a page on their website if you want to get more information for your dental office. Coco Floss also gives, you can purchase small little ones that you can put in your patient take-home bags as well. And every time I get my teeth cleaned, my hygienist actually gives me this in my take-home bag. So are natural toothpastes safe and effective? Yes. Numerous studies are showing that herbal toothpaste and rinses are effective for treating or preventing gingivitis, bleeding, plaque, and stains. Studies do not include reduced caries risk, only gingival scores typically. They're short-term studies, and I want to just point out that there's no remineralization and no fluoride. So again, that would have to depend on your risk assessment. Acupuncture and dentistry. Acupuncture is now considered an adjunctive therapy in Western medicine. 35 years of neurophysical research. The majority of insurance companies do cover acupuncture, and the FDA does regulate acupuncture needles the same as other medical devices like scalpels and syringes to ensure good manufacturing practices and single-use standards. Acupuncture involves the insertion of thin needles through your skin at strategic points, most commonly used to treat pain. Eastern medicine acupuncture is intended to balance your energy and cure diseases. Western medicine is intended to stimulate nerves, muscles, connective tissue, and boost your body's natural painkillers and improve blood flow. There's at least 75 published articles on acupuncture and dentistry, 3 different ways you can introduce it. The teeth approach, tried everything else, try homeopathy, or supplement, adjunct, or replacement for things like non-steroidal anti-inflammatories, night guards, muscle relaxers, and pain medication. Acupuncture has been shown to help in reduction of post-op pain, reduction of the time and the onset of local anesthesia, helping with gag reflex, pre-op anxiety, pain management, migraines, and xerostomia. How do you get trained to do acupuncture? Well, you can go into an entry-level master's degree program, or for those already holding a master's degree in a health-related field, such as doctors, dentists, physical therapists, it's a 40 hours of additional education. You do have to take a board examination, and all educational programs in the United States are accredited and recognized by the U.S. Department of Education. The Dental Tribune posted in April and May of 2017, acupuncture probing its way into dentistry to help you stimulate nerves, neuropeptides, anti-inflammatory, and increase blood flow. Of course, helping with the things we already talked about, but I want to point out here, xerostomia, especially related to Sjogren's and radiation therapy. So here's the end. You guys have been awesome. Do it yourself trends. We're almost to the end. Thanks for hanging in there. This is where the charcoal craze came from. We all know that activated carbon has been used in hospitals for many, many years as a detoxification, especially if somebody goes in for poisoning. It's the first thing that they do. Then it went to beauty products, right? These charcoal masks to pull out all the toxins to leave us with nice, pretty skin. And now it has gone to the toothpaste craze. And there's a couple different ways that patients can use activated charcoal. They can buy tablets that they just open up, put the powder into the cup, mix it with water, let it sit on your teeth. There's absolutely no research to show that activated charcoal whitens. It's not a bleaching agent. It is a mild abrasive, just like any other toothpaste or tooth powder. So it's very important to tell your patients there is no research to show that it actually is a whitening agent. Just like anything, though, it might take off some superficial stains. This is a product that I absolutely love, and this is what I recommend to all of my patients who absolutely want the activated carbon. This is a great product that can clean without abrading, no bleaching agents, and it does contain fluoride. No sodium lauryl sulfate, no triclosan, no bleaching agents, no plastic particles, can be used as a regular toothpaste without any limitations, and it's about $30 on Amazon. What does the ADA say? Right now, no charcoal teeth whitening products have been evaluated and accepted by the ADA, and our biggest concern is abrasiveness. However, I love Curaprox because look where it falls with the RDA value of 50. It is way down here at the bottom of the list, which means it's very, very safe. Charcoal is also making its way into teas and tonics to help cure hangovers, remove toxins. So this is why people are now looking to make their own toothpaste. They don't want triclosan. Maybe they don't want fluoride. They don't want sodium lauryl sulfate. They don't want glycerin, which is a soap. Some of them don't want abrasives and things like titanium dioxide. The big thing that a lot of patients really don't want, though, are dyes. FD&C blue dye number 2 has been linked to ADHD, behavior issues in children, and an increased risk of allergies. So if you're looking to make your own toothpaste, there's lots of recipes out there. Most of them start with a base of coconut oil, adding baking soda or bentonite clay to neutralize the pH of the mouth, stevia or xylitol for some sweetening benefits, and then your essential oils. Could be peppermint, cinnamon, myrrh, tea tree oil. If you're using essential oils and coconut oil, you absolutely want to try to store them in a glass container. And these concoctions don't last very long. Typically, you want to discard it after about 10 days and should no longer be using them after about 30 days. Do-it-yourself ortho, the Gap Band. This has been inspired by YouTube videos, articles in New Beauty magazine, Reader's Digest, AOL Health. Buy a package of rubber bands for $6.99, wrap them around your teeth to close spaces. We get very concerned because we know that this can lead to tooth loss, tissue damage, and bone loss. And you can see this is why patients might think it's perfectly safe. You can go to websites, and this is the type of thing that you're going to be seeing. Place the band, go to sleep, remove the band, and smile. They don't know that these bands can get lodged underneath the tissue, that we get concerned about moving teeth, we get concerned about bone loss, and tissue and hard and soft tissue destruction can happen really fast. We also have crystal braces and Smile Direct Club, orthodontic systems that patients are doing at home, no dental visits, about 1/3 of the cost. Of course, orthodontists are very concerned because no x-rays, no monitoring takes place, and they do not think a selfie is considered a diagnostic tool. And this is the end. Our patients who want a more natural approach typically also don't want x-rays. If you haven't revisited these standards for a while, please go back and look at them. Radiographs should be based on risk assessment, 6, 12, 18, or 30 months, 36 months based on risk. No longer should everybody be getting the same radiographs. So the goal today was to help you encourage your patients to take an active role in their health. Let them feel comfortable asking you questions, be a partner in treatment planning. We can collaborate with them. We can talk about evidence and disease, but also quality of life. We can be better at listening more and talking less. And we know if we do all these things, our patients are much more likely to adhere to our treatment plans. So I'm sorry, I was going to leave you 5 minutes. I only left you 4 minutes for questions. Please feel free to reach out and email me anytime. I would be absolutely more than happy to help. I'm going to go ahead here and look at some of these questions. Are there any toothpaste powders or pastes that are not crazy expensive? There's a wide range. I would say, I consider them all pretty expensive. And typically the ones that have a little bit more research, a little more high quality, are typically going to be a little bit more expensive. So again, the cost isn't seeming to play a role. Patients are willing to pay more for natural products. That Theodent toothpaste, $120. People will pay for things that they see value in. So I haven't found any that are really reasonable that I would consider safe. What's your go-to instructions on products who refuse fluoride? Obviously, we are always going to have those patients who refuse fluoride. I'm a compromise person. I don't believe in all or nothing, so I always try to get them to use fluoride. I love Enamel-On treatment gel because it's 1/5 the amount of fluoride. Or I recommend a fluoride varnish, one varnish once or twice a year instead of using a daily product. So I always still try to go the fluoride route whenever I absolutely can. There's a question here that says, do you think baking soda use every day is safe? Well, that's a tricky question because we do know that the RDA level of baking soda is 7. It's actually at the very, very bottom of the list. But it depends on how hard are people brushing. Are they using super hard bristles? Those things are going to be much more abrasive. So in general, it probably is okay for safe use. Arm & Hammer, I think, still makes a baking soda toothpaste and RDA value is 8. So looking for it in safe products, soft brushing, soft bristles like those Woo Bamboo bristles. I love the extra super soft ones. That actually helps a lot. Does all charcoal powder have the same abrasive score, or does it vary from product to product? It is all over the board, and most of them don't advertise or test abrasiveness at all. So that's why I stick with the Curaprox, because it advertises it. Most charcoal products, you're not going to find any research or any advertising of RDA levels, and when you do, they're kind of all over the place. Okay, well, it looks like I got to most of the questions. Again, please feel free to reach out to me. Somebody said, I love the idea of the bamboo toothbrush for the office. Absolutely, especially if you can have it imprinted with your name or office number for $1.17. It's a great way to really stand out from the crowd and protect the environment. So you guys were awesome. Thank you so much. My email is lancetvg@gmail.com, and I look forward to hearing from you, and please let me know if there's anything else I can do for you. And I hope you guys have a great night. Thanks so much.